There are a number of clinical trials, ongoing clinical trials, looking at other PARP inhibitors like the PRIMA study with niraparib. That study has not been reported, but we are expecting efficacy data by the end of 2019. Similar to SOLO-1, but a different PARP inhibitor, and the study is not limited to patients with BRCA mutations. A number of other studies, like Athena with the PARP inhibitor rucaparib, is a complex study that is looking also at various combinations of PARP inhibitor plus checkpoint inhibitors versus single agents in maintenance. One is to define the patient population. For now, SOLO-1 addressed only maintenance in BRCA for patients with a BRCA mutation. The attempt of the other studies is to define other subgroups of ovarian patients who may benefit from maintenance, whether these patients will be selected based on other molecular targets like the HRD or the LOH targets, whether maintenance can benefit everybody, as we have seen in a recurrent setting. That's to be seen. So one challenge is to define the patient population. I think the second challenge is to understand the long-term benefit of maintenance. And as I mentioned, the goal is to improve the cure rate. We don't have the answer for that. And in a way, it may be difficult to even find the answer regarding cure rate based on these clinical trials, because the primary objectives of this studies was actually progression-free survival.